want to hand it off to the doctors. The entire medical team has been amazing, an amazing resource, and Dr. Rocker and Dr. Lisker have given, I can't say, thousands of hours to provide their guidance and wisdom along with the rest of the team. We are tremendously grateful for everything and for their being with us tonight as well. So I'm going to hand it off to Dr. Rocker and Dr. Lisker to give us an update on what is going on now around our area.
Hello. Hello, how's everyone doing? It seems like just yesterday, not really, that we were just here discussing the very early phases. So I think in regards to when I was thinking about what we should be discussing, I'll go over some basics and some stats. We'll talk about kids in general, and then we'll touch upon some current events as well, and then we'll really talk about New York specific issues. And then Gita is going to talk more about sort of the hospital experience and you know, maybe add a little musser. I'm going to state some things that everyone already knows, but just to sort of put it out there, because New York had a very emotional experience during March and April, and you know, we were in lockdown, the hospitals were booked to the gills, and it was a very, very uncomfortable time. And then it slowly faded, and it was surprising. After rallies, you know, with the Black Lives Matter, everyone was like, oh, it's gonna rise again. After Memorial Day and barbecue, oh, it's gonna rise. And it never rose that much. And it surprised a lot of people because there was a lot of gathering and there wasn't always mask wearing. And then I think a lot of people started saying, it must be the outdoors. And I believe that is the consensus to a major extent, is that ventilation outdoors really makes a huge difference. And the scary part right now is weather's starting to change. And then we're going to start transitioning to really having to be much more indoors than in the past. But let's just review the numbers. Nationally, over 7.1 million cases of, you know, that have been diagnosed. And we know in March and April, we had limited tests. And so we know that number is actually much higher. And then in regards to deaths, we surpassed 200,000. And so for those who were questioning the comparison between COVID and influenza, influenza on average has, you know, 60 to 80,000 deaths per year. So obviously very significant, and in a much compressed time period, but we are now significantly higher than that. And we're not sure where that's going to end. The estimates that the professionals are giving are probably closer to 400 to 450,000 deaths in the United States. So we are, you know, dealing with obviously something extraordinarily serious. And I think we have to get out of the clouds a little bit, because we had a summer where we thought about it, but it really wasn't around us. But we're now seeing slowly the uptick in our region. So talking about testing, I mean, I think testing for the most part, supplies are very good. And there's been a real reinforcing at institutions where they're stockpiling a lot of these things. It's going to be interesting what we see midwinter, or sort of like, you know, mid-respiratory viral season, how we're doing with supplies. But right now, it seems fine, and we predict that it will be fine as well. And now what a lot of people are doing are they're testing for multiple viruses in addition to COVID, which is very helpful for when we do that, because then we could say, it is rhinoenterovirus is the common cold. And when we see people come back COVID negative, rhinoenteropositive, that's very helpful. And then especially if, you know, the sibling, you know, gets it the next day, we know it's, you know, the same virus. So it's nice to have what we call the alternative diagnosis. In regards to the vaccine, I know last night, if people were watching the debate, there's sort of different sides. I will go with the scientists. We do not anticipate a widely distributed vaccine for months. right? And when a vaccine becomes initially available, it's going to be offered mostly to healthcare workers and those at risk initially. So in regards to healthy young kids or healthy parents, that they are going to be at the end of the line. And obviously a lot more research needs to go into the safety and the efficacy of these vaccines. So I would not anticipate a vaccine coming to save the day, for months. In regards to convalescent serum, in regards to antibodies in someone else, the FDA just recently said that it may be effective. So it is certainly not a panacea, because people were like, oh, we have to run out and get this. We have to, and it was wonderful to see communities who were hit hard then offer and donate blood so that this could be used in the future. It is not as effective as some people initially thought, but there may be some mild role for it. That's just a little bit of background about where we are in the country in regards to research, in regards to vaccine. In regards to kids, the CDC published some information just the other day. There total around 277,000 cases in kids 5 to 17, and only 1% were hospitalized. Which is very different, than in adults. Those that were hospitalized, the vast majority of them, vast majority did well, and there were very few fatalities, only 51 fatalities from COVID, which is dramatically different than influenza. Influenza, even though the numbers I said earlier, usually has 2, 3, 4 times as many, deaths per year than the number I just gave you. So in regards to COVID and kids, what we said before, we're still saying doesn't really have a significant impact. And the younger you are, the safer you are. And of those who unfortunately died from COVID, 25% of them or 28% of them had medical conditions that put them at risk as well. So now let's talk about New York. You tell me if these towns sound familiar. Far Rockaway, Ocean Parkway, Flatbush, Borough Park, Kew Gardens, Rego Park, Brighton Beach. Those are New York City zip code or towns that have the highest rate of COVID currently. Governor Cuomo is meeting with Orthodox Jewish leaders. That's not a good thing, right? When the governor has to go to, our community, and obviously not necessarily the SAR community, but to our community to speak to us directly, because we are responsible, and I'm saying we as a collective, we are responsible for increased numbers. So New York State, we're talking about a 1.1% positive test rate. In some of these areas, 5%, 7%. And then you're talking about areas in Rockland County, Orange County, where we're talking areas that are having 30% positivity. It is scary. And these are the same communities that were hit significantly before. So when people say, oh, I had it or it was in our community before, it's not going to be so bad this time, that's not true, right? The numbers are showing that it is still impacting the same areas that were hit last time, and it's the same irresponsible behaviors that people were doing then that they're doing now. The police are breaking up gatherings, the police are breaking up parties. It's not just within our community, in other communities as well. But we have to be responsible, and we have to act in an appropriate way during the upcoming holidays. What, Rabbi Hartsock and Benny were saying is the schools have been a godsend for the kids. It has been wonderful for the kids to be back into school, and they are enjoying it. We are hanging on by a thread to a certain extent because we are seeing the rise within our communities. Within Queens, the vast majority of yeshivas in Queens have closed, right? They haven't closed permanently, but they've closed out of risk or because they have significant number of increases in their schools. So from a school perspective, There are so many people who are reliant on their kids to be there for their mental health, for in the general well-being, and obviously for their education. So it behooves us all to be responsible. And Vinny made reference to it, is that the impact on the kids is phenomenal, but also the impact on us where we're just tired of it. It's 100% understandable. It is exhausting. It is terrible, right? To have to, modify the way we are behaving. But unfortunately, that's the situation we're in right now. I don't want to go on and belabor it as much, but I'm going to tag Dr. Gita Lisker, who's going to give a little bit more information to sort of give her perspective as well. But I thank you guys all tremendously for doing everything that you are doing, because we are in a tough situation right now. But specifically in the Jewish communities right now, Judaism, thank God, is a social religion, and we get together and we love getting together, and that's important. But right now, it really is our responsibility to be safe for the whole community. Gita, take it away.
Thank you. Thank you, everybody. And although I am the Musser person, I am going to start with an amazing thank you. So I will start by saying, as I always do, that to no surprise to me, the SAR administration, faculty, parent body, and entire community has never ceased to stop amazing me. As I sit here in Queens, where I live, and I watch the schools close in Queens, in Brooklyn, on Long Island, in Jersey, in Manhattan, grades at a time. I mean, literally everywhere. We have not. And while to some extent, a little bit luck never hurts, a lot of that just has to do with the exceptional responsiveness and responsibility of our parent body at reporting symptoms and at asking questions that they're not afraid to ask. It has to do with the administration having the foresight to set up our testing. It has to do with our nurses working tirelessly that I cannot even imagine. And so I thank everybody, and I'm not surprised at all to see that, that the SAR community has made it this far. I'm really not. That being said, the other schools that have been closing, and they are from everywhere, they're really not just Queens and Brooklyn, it's really everywhere. And I want to be clear that the schools are not closing because of behavior that's happening in school. The spread of the disease is not happening in our schools. It's happening because of what's happening outside of school. And a lot of it has to do with what the adults and the parents are doing. And right now, whether we like it or not, the Department of Health are scrutinizing every single yeshiva, and we have to be as best as we possibly can. And it's literally up to us. And if we are not close to perfect, the natural consequence is going to be that we're going to close. Or we will either have to close or be closed, but it's up to us to be able to do that. And I really think that we can. So I'm making a plea for everyone to follow the rules for several reasons. Number one, and again, everybody has said, and I'm not going to elaborate on, to keep the schools open and to keep the kids in school. We all know how important it is. And the only way that it's going to happen is if our parent body behaves and we get lucky enough not to be interfered upon by others. Number two is for the good of the Jews as a whole. And this is where, and I'm not speaking to the SAR community, I'm speaking to the Jewish community as a whole, and I'm going to sound bitter because I am. I and my colleagues that I've spoken to who come from the Orthodox Jewish community and are in medicine as I am literally these days embarrassed to go to work. I'm embarrassed to go explain to a colleague, to Zoom rooms full of ICU doctors, how and why my people are behaving the way that they are. I mean, I have no explanation for it, but to try to explain how the people who they associate with me are acting in such irresponsible, disrespectful, and just completely just no regard for human life, and to try to explain that to my colleagues is embarrassing. I mean, I can come up with a million adjectives, from embarrassed, I'm angry, I'm scared, and mostly I'm just anxious. I'm anxious, and I speak to my fellow colleagues who are as anxious as I am. You know, and I'm just going to remind you, if you and your families were lucky enough to really not to be spared significant harm, and maybe we forget, and maybe the difficulty of the way we've been living is blurring our memory for what we went through, I'm just here to let you know that every one of my colleagues that I have, myself very much included, there is real PTSD. We will never be the same. The healthcare workers that were in the hospitals, or not in the hospitals, in the offices taking care of people, or just having to make administrative decisions, will never ever be the same based on what we saw in the spring. And legitimately, there are many of us who are just not convinced that we can ever do it, honestly, that we can do it again. Least of all, to do it again, and worst of all, to be able to take care of members of our own community as the patients and as the victims. That it's really just, I don't know what else to say. I'm baffled, I'm upset, and I cannot understand what is happening, and it literally is happening within the Jewish communities, not just in Queens and Brooklyn, but from all over, and it just has to stop. It was Purim, when we didn't know better, that led to the initial carnage that went through the Jewish communities. By Pesach, we knew better, but there was still a second wave. We didn't modify our behaviors enough. I mean, my grandfather passed away on the last day of Pesach of COVID. It took 3 hours for the Chevra Kadisha to come because there were 7 bodies before him. I don't know what else to say. We are already seeing the effects from Rosh Hashanah, and Rosh Hashanah is not a social holiday for the most part, and we are seeing the numbers really skyrocketing beyond belief. And with Sukkot coming up, all I can really say is not to let Sukkot be a literal and figurative nail in the coffin of the Jewish communities. I don't know what else to say. I hear what people are saying. It just needs to stop. So this is me imploring you, all of you, and myself included. And it was just as hard for me. And again, I'm going to say this knowing that I really think that the SAR community is being much better about this and truly should be leaders that are being followed by other Jewish communities. But we're not perfect, and we are certainly not impervious to the effects of the other communities coming into ours. And if we think we are, then we've learned nothing. If you're sitting in a community not currently in one of the zip codes and you think, well, that's them, not me, I think we all know better. And I think we all know that what started in New Rochelle and Riverdale very quickly moved. That's just by nature of the way that we are. So it's not too late. It's Wednesday night, and we as a community in SAR, a community of our parents who care about our kids, a community of doctors are begging you. It's not too late to change your plans. Don't host company from other neighborhoods. Don't go to other neighborhoods for Yontif. Don't have sleepover company. I mean, I've been asking around, and I'm not here in any way to give up sock, but if you feel that you need to host or go to somewhere else because you need to eat in a sukkah, ask your Rav. You may be surprised at the answer when it comes to the danger of this. Limit the meals that you have. The sukkah is not outside. If you can build it with 3 walls, that's better. It's not outside, it's an indoor space. And when you're eating, you're not wearing a mask. Limit the gatherings. Masks are great, but they're not enough. If you're going to be together for extended periods of time, close together, wearing a mask is not going to save you from quarantine, and it's not going to save you from transmission. It might be less. It's great, and you should definitely wear your masks, but it's not enough. And certainly during meal times, nobody's wearing their masks. So all I can just tell you is that this is in our control. Whether or not our school stays open, which God knows we all hope it does, and whether or not our communities make it through this is in our control. And so all I'm asking is, it's hard for me, it's hard for every single one of us on this call. We have no choice. Literally for our health and safety of our community and for the reputation of our communities, it has to stop. And we're supposed to be the exemplary behavior crowd, and that's all I'm asking. And so as difficult as it is, I really think the SAR community can do it better than anybody else's. And so thank you.
Gita, thank you. Gita, I know that I speak for all the other rabbis here, that you're definitely our posek tonight, and Chamira Sakanta Meisura, and that's what it's about. It's about saving lives, and certainly, please, 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 every single word that she said, it was very powerful when you shared it with us when we had our last meeting on Sunday, and that's really what got us to here tonight. You talked about that, and it's important to talk about that PTSD because it is easy to forget, and it's easy to slip back into it. And what I'm liking on the chat is just people encouraging each other to do the right thing. Everybody wants to do the right thing. Nobody wants to get hurt. Nobody wants to hurt anybody else. But sometimes it's just hard. And when we remember that, and we remember that it's worth it, that makes all the difference. So, you know, we saw there were some questions and some suggestions. Yes, make commitments to each other, please. Make commitments to make the Yom Tov a little bit more challenging. Hopefully, still meaningful, like Rabbi Hartstark said, but giving something up. We're all giving something up, and definitely be lenient about the Sukkah. If it's going to put yourself in danger, there's nothing to talk about. I really don't think that there is, and certainly comfortable following your lead on that. There were some questions that I'll send back to you in terms of the test. I'll just say quickly, and you, Dr. Lister, Dr. Rocker, you can add to that. We do not accept rapid tests. We do accept the molecular, what's called the rapid molecular test, that Abbott test that we've been allowing, which has been very helpful, including today when we need to get results quickly. But we're only accepting PCR tests and that test as well. Gita, do you want to add something about that in terms of our testing decisions? I know that you felt strongly about the antigen tests, and we do not accept those.
Correct. That is all that we're accepting now, and really just to be clear again that this is very fluid. Even that, as the testing standards and what we accept and what we don't accept also varies based on what the prevalence is and what the rates are in the community. So right now, the PCR is always the gold standard, and the Abbott as the molecular test is there. But you know, everything changes with prevalence, so we'll have to keep an eye on that too.
There's some questions about who makes the decisions. You know, you've been reading the same news that I've been reading, and we're speaking to all the same people. You know, nobody from the city or the state wants to say that they don't make the decision. So what we're trying to do is to keep our relationships up, positive, and you know, and lines of communication up with both of them. Yes, 3% for 7 days has been mentioned for public schools. It's not absolute for private schools. As of today, they did not tell me that they would, you know, necessarily close a whole region down for that, especially if it's a 3% that's largely based somewhere else. There's the 2 kids in a school in different pods, which has been talked about for the public schools, and we very, very much hope that that would not be the case for us. There's no real reason for that, and I think we got agreement from the Board of Health today on that. But you know, it's both. I mean, the state has a certain level of jurisdiction, and they're turning to the local departments of health to be more on the ground, and we're, you know, New York City is a big place, so we're working with both. Yes, that's Tamar, that's what we're talking about. So that's not necessarily something that private schools are going to be required to abide by, but it's a little early too early to tell because it hasn't come up much. The schools that have been closed have had more than 2 cases, the ones that we're aware of. Tully, I can't get everything. If there's something I missed that you want to address or you want to ask the doctors.
I think you've covered most of it, looks to me.
Dr. Rocker, can grandparents sit in the sukkah with their grandchildren? No, we got them on. There you go.
Sorry about that. So I saw that there was a lot of chat about the Sukkah as well. And the one thing that I mentioned is, remember, every year during Sukkot, when we are sitting outside, it starts to rain at some point, and we ultimately end up inside with our guests. So can we have guests? I don't think we have to behave in a way so differently than what we have in school, right? If we are safe distance, then it should be safe. The thing is sukkahs are small. And so you have to understand the dimensions of your sukkah. You know, if you are inviting people over, we certainly don't recommend a large number at all, but you have to understand, if you are inviting people over, there has to be distance between you. You are going to be, by definition, without a mask next to each other. So if you can be a distance from each other, you know, it's good aeration, I think that is okay. In regards to grandparents, obviously, that is a decision that people have to make, but it is a decision that has to be made with the consideration of the distance. And also with the understanding, if grandparents are coming over, and if they don't live in the community, that means they're probably sleeping over, right? And so if they're sleeping over, you know, that may be, that is, you know, a risk. And again, once it starts to rain, you know, are you all going inside and eating together inside? And that's going to be a little bit more of an issue. So I think we should be extra cautious right now while it is, you know, rising within the Jewish community. And, you know, after the Chag, you know, sort of reset see where we are, see where the incidence is going, and then, make decisions based upon the numbers at that point. But right now, and this is what happened in March, it silently creeps up on you. You don't know, when their numbers are slowly going up. And I can tell you, in sort of the Manhattan, Queens, and Westchester areas, the numbers in the hospitalizations within the Northwell health system where I work are going up, right? They've almost doubled in regards to just a week ago for COVID cases. Still not very high, still not close to where we were in March or April, but that's how it starts. And I think we are in a much better place. I think we're better educated, and I think people's sense of responsibility is very different. But how did I get onto this in regards to the grandparent question? But the issue is, remember, people, if they don't live nearby, if it rains, people should go home. Right? They should not be coming into your house to finish up the meals together. And so if you cannot do that because and you're having people sleep over, that's problematic.
Okay. There's a question about what our policy has been or practice has been in terms of quarantining. So right, there have not been any positive cases in terms of students or teachers in the school since the school started. We've had some close calls and we've had some close contact. So what that means is that and some difficult calls. Now, normally, if somebody, let's say you have a sibling in another school and that whole grade is quarantined, that doesn't prevent the other siblings from coming to SAR. That would make them kind of contacts of contacts, and that doesn't prevent them. When it gets closer, if you've got somebody in your family who's tested positive, then obviously, or even has high risk symptoms, and those kids and those siblings can't come into school. But again, we would not then quarantine the contact of those contacts. So if my siblings are positive, that doesn't mean that all the people in my pod are now positive. But as Gita said, with new cases coming up, new situations coming up with new information, it doesn't mean that everything's going to be dealt with exactly the same way. But that's basically the practice that we've been working with until now. So there have been, for example, siblings or family members or we've had people in the school who have had close contact. Those people are quarantined, but those pods have remained intact. Gita or Josh, anything you want to say about that I missed or didn't explain clearly? Okay.
If I can, Right, Krause, I just wanted to add one thing about partnering and family sharing information, which has been very helpful. I want to say something about the Ruvna service, which has been, we had originally set that up in order to screen everyone before coming into our respective buildings. It also has been a very useful source of information and to just have a sense of where everyone is at. Two things that I want to bring to your attention. One, while there's a set number of questions that can be asked within the Ruvna set of questions, those are going to be changed as we continue moving through the year. And I want to, God willing, we're going to come back in Sukkot. This is really just encouraging everyone. Part of the routine, when you get into that routine, you just say no, 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 and kind of come to school. But the circumstances change, and therefore some of the questions will change. So I want to make sure that people are reading those carefully when you come back to school. And also, we're going to ask, this is in the high school where there are students one day where one grade is staying at home. When we were thinking about Ruvna as screening to get into the building, so when students were at home, we didn't ask parents to fill that out. When we return, we're actually going to ask that everyone fill out Ruvna, whether they are coming to school that day or not. It just allows another source of information for RUSI and our nursing staff to be aware and be able to reach out to you so that we can partner earlier. That one day, and we've had, it was said that we're kind of getting by, hanging by a thread and getting, in making this work. One day we have seen actually where it made a difference to know that someone wasn't feeling well and be able to respond quickly. That day at home might make the difference. So we will be asking for that as well. Thank you for your cooperation with all of that.
I think schools have been giving guidance around Simchas Torah. If the doctors want to give their own guidance, they're certainly welcome to. The answer to the question about, what was the question? Will there be Sukkot activity at school during Chol HaMoed? It'll be learning only. Definitely not learning only. That would not be okay. We're going to definitely try to make it a meaningful and fun Sukkot, but it is going to be different. The activities will be different. They will be more limited. Even the sharing, there's going to be no sharing of Arba Minim. We're going to be doing, whatever we do, there's going to be limited ability to get into the Sukkah. First and second graders won't be able to get into the Sukkah during lunchtime. These are the limitations when you can put 40 kids instead of 120 kids in the Sukkah. But we're certainly hoping to have Tuesday, Wednesday, Thursday of Chol HaMoed be fun, festive, meaningful, and some learning too. But a little bit of both. Josh, what about Simchas Torah? We don't have to talk about Simchas Torah, but.
Yeah, I mean, I think we're going to see what the incidence is over time, over the next week or so. And if we're seeing the trend and rise, then we just really have to be extraordinarily strict about Simchas Torah. So dancing, no, getting close, it's. I think most shuls have adapted policies that will, I hope, they're going to be safe for the congregants. And so it's going to be, hopefully the shul is outdoors, hopefully there's distancing, and we'll see from there. But yeah, in regards to dancing close together, dancing, physical exertion. So at that point, it's 12 feet rather than 6 feet. And so that's something that's really not able to be able to.
I know that my Rabbi Hain is online, and I think he's planning on sending out some Simchas Torah guidelines. I imagine your shul is as well. And hopefully that will be helpful to you. Thank you, Miriam, for mentioning testing overview and instruction was outstanding. Tina Lerner, who's here tonight, I think, and she's been doing amazing and helpful work on testing and on research and putting together that testing document. So thank you, Tina.
Rabbi Kratley, I just wanted to add, when we were talking about Simchas Torah, it's, I think, important for people to know, it might have come to your attention that high schools, schools generally around the region, talking about whether to close school after, to go to Zoom after Sukkot in order to give some kind of space before returning to school. And that has been a very, it's certainly been a topic of discussion amongst the team here about what the right way to go is. And we are planning on being in school after Sukkot. And that decision is totally rooted very strongly in everything that has been said tonight. The importance of, we want kids to be in school, we want to be safe to be in school, and therefore we got to treat Yontif, be very careful and following all the directions that have been put forward. And I think that just being aware of that kind of decision and why it is that we are wanting to be in school, and also relying on each other to really take what the doctors have said to heart very, very strongly, and to make those commitments and decisions so that we can all return right after Sukkot.
Okay, I think we got to, there's one question, doctors, about getting together with kids from different classes or different pods outside of school, outdoors with social distancing. I don't want to answer it, you can answer it, you're here.
I mean, I think the rules that apply to school have been established because they're safe. And so those are the same rules that we should be applying at home. So
I think the question is about mixing pod, right? In other words, right, in school we don't mix pods. So the question is, should your play dates, even outside, just be with people in your pod or in your grade or in your class, whatever, whatever the case may be?
Right. So certainly in the high school, there aren't the pods, and so it doesn't apply as much. So obviously the ideal would be to be within the pods. If people are social distance and wearing masks, I think there can be some mixing. But again, if you don't think that they could adhere to it, then you shouldn't.
Okay.
Just one thing I wanted to bring up as well, because I've heard this conversation by some people about antibodies. I was exposed, I have antibodies, and thus I'm immune. I can't get it. So we certainly know if you have antibodies, the likelihood of you getting it is extraordinarily low, right? But we don't know how long the antibodies last for. And most people who have had their antibody test had it weeks or months ago. And so there's still a lot of research to be done about how long the antibodies last for and how protective the antibodies are. So we do know people who have had antibodies positive and have gotten sick again. It is a small number, but I think people still have to be cautious. So, right now, sort of a vague number is 4 months. Anything less than that, probably some likely protected. After that, we don't know. And, again, with a new virus, and we're not exactly sure of the full immunity afterwards. So if you had antibodies because of an exposure in March, April, great. There was a certain sense of protection during the summer. I'm not sure that sense of protection should still be there.
I'm just generally, we're way over time. We thought this was a 30-minute meeting, but I'm very grateful to our doctors for really presenting these important messages to us. We've come out with explicit guidelines about certain things. We've joined other schools about carrying out with recommendations and guidelines. There's obviously a little bit of a dance here in terms of what is in our purview and what is not. I think that bar mitzvahs, for example, we've been very, very explicit and very clear about exactly what those guidelines are. And other times that we've asked for very good judgment and good decision making. And again, as Gita said, we will continue to look and continue to change our policies and our recommendations with what we see. But the bottom line is we're asking everybody to understand that this is still very much present, and we need everyone's cooperation, in partnership to keep each other and the people around us in school and out of school safe, and to be able to keep our school open. Thank you very, very much. Sorry for going over time, but thank you all for your attention. Wishing you a Chag Sameach. Thank you.